Genus Habronema. Genus Habronema. Genus Habronema. Habronema morphology. Habronema, commonly known as stomach worm, found in horses. Adult has two lateral lip, dorsal and ventral lip may also be present. Buccal capsule cylindrical and chitinous. Esophagus is divided into two parts, a short anterior muscular and long posterior glandular portion. Intestine is simple without any diverticula. The male have unequal spicule gubernaculum present and bears 4 pair of preanal, first pair adenal and second pair of posternal pedunculated papillae. 3 pair of sessile papillae also present. Male have also a spirally twisted tail. Habronema megastoma. Habronema megastoma. Draschia megastoma. Habronema life cycle. They have an indirect life cycle with intermediate host, mainly housefly Musca domestica, Habronema musci, and Draschia megastoma, stable fly stomachs, calcitrans, Habronema microstoma. Adult female worm lay egg or release L1 larvae in the stomach of the horses that are passed with the feces. These larvae are ingested by fly maggot found in the horse manner. They further develop to infective L3 larvae inside the maggot within about 2 weeks. The fly maggot complete their development to adult fly. The infective L3 larvae migrate to the mouth of the fly, from where they are deposited on the final host, horse, donkey, tissue visited by the fly. Habronema life cycle. They are often deposited on humid part of the host body, eye, nose, lip, genitalia, open wound, etc., to which many fly are attracted. The infective L3 larvae swallowed by final host and get into the stomach, where they complete development to adult worm within about 2 months. Infective L3 larvae can also infect the host if they swallow fly, example with the food, or while grooming when the lick with their own wounds infected with L3 larvae. The occurrence of the fly is seasonal. Strongyle depends on climatic condition, temperature, humidity, etc. The peak seasons for infection is summer and early autumn. Habronema life cycle. Musca domestica, the transmitter agent. Stomachs, calcitrans, the vector. Transmission of Habronema by flies. Habronema pathogenesis. Adult well as young horses are equally affected. Adult worm in the stomach. Gastric habronemiasis of horses are usually not very pathogenic in light infection. A massive infection causes gastritis, colic, and other digestive disorders resulting in weight loss. Draschia megastoma can cause tumor-like swelling in the stomach wall that can burst and cause fetal peritonitis, but this is rather unusual. Infective L3 larvae deposit on the eye cause ocular ophthalmic or conjunctival habronemiasis, resulting into inflammation of the eyelid, example conjunctivitis infective. Small hazelnut-like nodule can appear around the bronchi. L3 larvae deposit on skin wound, produce called skin or cutaneous habronemiasis, also known as summer sore. They produce granulomatous skin reaction, erosion, swelling, etc. that cause strong itching and Such infected wounds are difficult to heal, can become infected with secondary bacteria, and may attract other fly species that can cause meiosis. Example: screwworm. Occasionally infected L3 larvae deposit on the nostril can migrate into the lungs of the host and cause pulmonary habronemiasis. Affected horses may show chronic cough, difficult breathing, and reduced performance. Summer sore in abdominal region. Summer sore. Summer sore. Equine cutaneous habronomiasis. Ocular habromiasis. Habronemiasis in who? Habronemiasis in previous region. Non-healing granuloma. Non-healing granuloma. Habronema diagnosis. Clinical signs and symptoms by observing non-healing skin wounds showing reddish to brownish color and containing rice grain like calcified material are typical for skin habronemiasis. Diagnosis of gastric infection is difficult because the small eggs or L1 larvae passed in the feces are easily missed in fecal examination. Larvae may be found in scraping of such wound. Habronemiasis. Habronema prevention and control. We can minimize the risk of infection by adequate management to break the life cycle of the worm. Regular manner remove stable can significantly reduce the fly population and make it less suitable for maggot development. Repellent that keep fly away from horses can also be used, but most of them have a very short effect, only for of a few days. Genus Thelazia. Genus Thelazia. Genus Thelazia. Thelazia morphology. These are parasitic worms commonly known as eye worm. It was first discovered in the eye of a dog in China. The adult worm typically measures 5 to 20 mm in length. The males tend to be smaller than the females in size. They have a distinct buccal capsule and a cuticle with space transverse striation, giving it a rigid appearance. This is distinguishable character from other worms. Adult female identified by the position of their vulva, which is anterior to the esophagus intestinal junction. The male can be distinguished by their possession of 5 pair of postcloacal papillae. Thelazia. Thelazia in eye. Thelazia life cycle. These worms are viviparous and having indirect life cycle. The eggs of Thelazia develop into first stage larvae L1 in uterus of female worm in and around the eye of the definitive host. The female deposits these larvae, which are still enclosed in the egg membranes in the tears, lacrimal secretion of the host. When a tear feeding fly, intermediate host feed in just the Thelazia larvae. Inside the fly, the L1 larva hatch from the egg membrane and penetrate the gut wall. In this tissue, the larva develop into third stage larvae L3. L3 migrate to the head of the fly and is released in or near the eye of a new host when the fly feeds again. Once in the eye, eyelid, tear gland or tear duct of the host, the L3 larvae develop through the L4 larva stage and into adult. Transmission of eye worm by fly. Thelazia capita life cycle. Thelazia life cycle in man. Thelazia life cycle in dog. Thelazia pathogenesis. The infections are more frequent during the fly season. Example from the late spring to early autumn. Cattle aged 3-4 years are more often affected than older animals. Large dogs 3 to 4-year-old are more likely to be infected than younger ones. Light infections are without clinical sign, but infection with 10 to 15 worm may cause conjunctivitis, keratitis, excessive lacrimation and watery eye, swollen eye, purulent exudation, excessive light sensitivity. Chronic infection can cause corneal damage and ulceration, which lead to blindness. Other part of the eye can also be damaged. The infection can also favor secondary infection with bacteria. Example with Moraxella bovis, the causative agent of bovine keratoconjunctivitis, also called pink eye. Thelazia in eye. Conjunctivitis caused by Thelazia. Corneal opacity caused by Thelazia. Canine cherry in dog. Canine cherry in dog. Pink eye in dog. Pink eye in man. Lective infectious keratitis. Peripheral ulcerative keratitis. Secondary bacterial infection in dog. Thelazia diagnosis. Thelazia diagnosis by usual examination of the eye and surrounding tissue. These worms are quite active and are seen moving quickly in the eyeball. It can also examined in the sediment of centrifugal wash obtained after eye or lacrimal duct drenching. Thelazia egg. Thelazia prevention and control. The protection against housefly, phase fly and filth fly during the fly season. Control of fly strongyle depend on removal of manure and waste in farm and general hygiene measures in gardens etc. Protection of pet from fly during the peak season of the fly by using fly repellent. Antihelminthics such as febendazole and leamisole are also available for worm control. For dog and cat, microcyclic lactones, example ivermectin, milbemycin, oxime, moxidectin, injectable, example moxidectin or sport 1, example selamectin, ocular drops, example moxidectin plus leamisole can be used. In cattle, sheep, goat and other livestock, microcyclic lactones are available as injectable porons or drenches, example doramectin, ivermectin, moxidectin. Genus Spirocerca. Genus Spirocerca. Genus Spirocerca. Spirocerca morphology. The adult worm are short, spirally colloid, cylindrical and bright pinkish to red in color. The mouth is surrounded by 6 lip are trilobed. They also have a well-developed buccal capsule with thick wall. Female are approximately 5 to 8 long, while male are slightly smaller, 3 to 5.5 cm long. Spicules are unequal. Male tail and has small laterally and have 5 pair and 1 median precloacal papillae and 2 pair of postcloacal papillae. Group of small papillae occurs at the tip of tail. Egg are gelatin capsule shaped thick shell and contain fully developed larvae. Spirocerca lupi. Spirocerca lupi. Spirocerca in stomach. Spirocerca life cycle. The adult was found in a nodule within the wall of the dog's thoracic esophagus. The female lays small embryonated eggs which are transferred into the esophageal lumen. Through esophageal lumen, the eggs are excreted in the feces. These eggs are ingested by the intermediate host, coprophagous beetles inside the beetles. They hatch and develop to the infective L3 stage within 2 months. The dogs of the other carnivores are infected by injection of an infected beetle harboring infective L3 stage. Sometimes transport hosts such as lizard, bird and rabbit may ingest beetles and remain infected. Spirocerca life cycle. These paratenic hosts transmit the infection to dogs when killed and ingest as prey. The infective larvae are released in the stomach of the definitive canine host. They penetrate the gastric mucosa and migrate within the wall of the gastric arteries to the thoracic aorta approximately 3 weeks after ingestion. About 3 months post-infection, the larva migrate from the aorta to the esophagus at the point between the diaphragm and the aortic arch. At this lactation, the worm initiates the development of granulomas as they mature to adult over the next 3 months. Spirocerca pathogenesis. Spirocerca pathogenesis. The growing esophageal tumor resulting into regurgitation and or vomiting due to blockage in esophageal lumen. Decreased intake of food result in considerable weight loss and emaciation. In some cases, death occurred due to rupture of an aortic aneurysm induced by migration of worm in the aortic wall. Esophageal granulomas and aortic scarring leading to aneurysm are the most frequent lesion. Spondylitis of the thoracic vertebrate and the development of hypertrophy osteopathy are typical lesions. Infection with SLP has also been associated with salivary gland necrosis. Fibrosarcoma or osteosarcoma can also be seen in spirocercosis. Local esophageal neoplasia with occasional metastasis to distinct organ is occasionally found. Tumor in esophagus. Spirocerca in esophageal tumor. Spirocerca in esophageal tumor. Spirocerca in esophageal tumor. Spirocerca in vertebrate. Spirocerca in vertebrae. Spirocerca diagnosis. Detection of characteristic ellipsoidal embryonated egg in fecal examination. Radiograph of affected dogs show esophageal granulomas in thoracic survey. Spondylitis of the caudal thoracic vertebrae is also frequently observed on radiographs. Esophagoscopy and gastroscopy allow direct visualization of the nodule showing protuberance with a distinct nipple-like orifice. Nodule may be solitary or multiply. Anti-helminthic therapy and a surgical intervention can also be practiced. Spirocerca prevention and control. Control can be made by prevention from intermediate host, beetle or transport host, lizard, frog, rodent, bird, including rice, chicken, etc. In kennels and boarding houses, feces and vomit must be thoroughly eliminated as soon as possible. Some dewormer for dogs such as doramectin and ivermectin under advice of veterinary doctor. There are so far no true vaccine against Spirocerca lupi. Genus Gongylonema, genus Gongylonema, genus Gongylonema morphology. They have a typical slender shape with a yellowish, brownish, or reddish color. The adult male are about 6 whereas female are 14 cm long. The worm's body is covered with a cuticle which is flexible but rather tough. When embedded in the wall of the esophagus, they show a typical zigzag shape. They have a tubular digestive system with two openings. They also have a nervous system but no excretory organ and no circulatory system. Males have chitinous spicules for attaching to the female during copulation. Gongylonema worms are not blood-suckling parasites but feed on tissue and fluid of Gongylonema life cycle. They have an indirect life cycle with sheep, goat, dog, cat, pig, and birds as final host, and dung beetle or cockroach as intermediate host. The vertebrates, including humans, can act as paratenic or transport host. Beetles or cockroach eat the egg set with the feces of infected host. This egg releases the L1 larvae inside the intermediate host, which develop to infective L3 larvae. The final host becomes infected when eating such infected beetle or cockroaches either directly with posture or indirectly through contaminated feed. The infective L3 larvae are released in the stomach of the final host. Most larvae migrate back to the esophagus and burrow in its wall where they develop to adult and start producing egg. Gongylonema life cycle. Gongylonema pathogenesis. Infection of livestock, horse, or pet are mostly showing no clinical sign. A slight inflammation of the esophagus or stomach wall may occur but is unusually asymptomatic. This parasite quickly spread down the esophagus, upper digestive and respiratory tract. In humans, the infection confined to oral cavity and is often surgically or manually excreted. Heavy infections lead to gastrointestinal disturbance that cause emaciation. The mucosal surface is characterized by irregular circumscribed wart-like thickening with a finally verrucous surface. Gongylonema in esophagus. Gongylonema diagnosis. Diagnosis is made by visible recognition of the worm moving through the tissue of the buccal cavity. Microscopic identification of worm removed from mouth or tissue. Gongylonema prevention and control. Best way of prevention is to keep livestock or pet away from pasture or feed contaminated with infected beetles or cockroach. Deworming livestock with antihelminthics can also be practiced. Nowadays, no vaccine available against Gongylonema worm. Biological control of Gongylonema worm is so far not feasible. Genus Physaloptera. Genus Physaloptera. Genus Physaloptera. Physaloptera morphology. These are small, stout, 3 to 4 cm long, medium-sized worm found in the stomach of dog and cat and commonly called as stomach worm of dog and cat. Adult worms are creamy white, sometimes tightly colloid. The females are larger than males. The worm's body is covered with a cuticle which is flexible but rather tough. The worm have no external sign of segmentation. They have a tubular digestive system with two openings. They also have a nervous system but no excretory organ and no circulatory system, neither a heart nor blood vessel. Male have chitinous spicules for attaching to the female during copulation. Physaloptera paraputilalis. Physaloptera paraputilalis. Physaloptera life cycle. They have an indirect life cycle. Dog, cat, and other vertebrates are final host. Various insects such as cricket, cockroaches, beetle act as intermediate host, and mice, frog, etc. are transport host. Adult female worm attached to the stomach lining of a final host produce eggs that are shed with the passage of the host. The insect indirect host eat these eggs, which release the larva after digestion. These larvae become encysted in the insect and remain infective. Transport host eat these insects and the larvae release in their stomachs and encysted again. When the transport hosts are eaten by dog and cat, the digested cysts liberated the larvae in the stomach, where they attach to the lining to adult worm and start producing egg. Pathogenesis. Pathogenesis. Most infections are remain asymptomatic. The presence of worm in the stomach irritate the gastric mucosa causing vomiting. Adult may be present in the vomitus, although the absence of nematodes in the vomit does not exclude the possibility of an infection. Massive infection can cause chronic gastritis, bleeding, anemia, diarrhea, chronic vomiting, and weight loss. Physaloptera preputialis. Physaloptera diagnosis. Examination of fecal sample for detection of egg. Gastroscopy in the most reliable diagnostic method. Worm may be found in the vomit of infected pet, especially in puppies and kittens. Physaloptera prevention and control. In the endemic area, dog and cat should be prevented from eating intermediate host, beetle, cricket, cockroach, or transport host, frog, rodent, etc. The kennel, cartridge, and boarding house passage and vomit must be thoroughly eliminated as soon as possible. Control of intermediate and paratinic host should be ensured. Antihelminthics such as febendazole, ivermectin, and parental pomade are very effective against infection. These are so far no true vaccine against this worm. Module 45 Gnathostomatidae. Gnathostomatidae. Learning objective. After reading this module, the learner will understand the following: zoonotic significance in human as accidental eye worm, spiny headed worm of cat. Gnathostoma spinigerum. Morphology: genus Gnathostoma, species Gnathostoma spinigerum. Host cat, dog, erratic parasite of man. Intermediate host: first Cyclops, copcod, and second freshwater fish. Location stomach. Morphology. Morphology. The mouth is surrounded by two large lips and are trilobed. The cuticle form tooth-like ridges on the medial surface of lip, interlocked. They have large head bulb consist of for some median cavity or ballonette contain fluid. The head bulb is armed with 6 to 11 rows of transverse spines. Anterior, second and third of the body also armed with large flat cuticular spine which is denticulate at the posterior margin. In male, the caudal and ventral surface is covered with small spine and armed with 4 pair of pedunculated and several papillae. Egg are oval, thick cell, greenish, ornamented and have small cap at the anterior pole. Egg contain one cell or morula stage. Gnathostoma, spinning garum life cycle. Egg are present in the faces of the host. They hatch in the water and liberated L1. These L1 swim in water for a few days and then should be ingested by the cyclops in the hemocoel cavity of cyclops L1 develop to L2. When infected cyclops is ingested by freshwater fish, the L2 mold to become L3 in the body cavity of fish. The L3 insists on various muscles of fish. Direct host acquired infection by injection of infected freshwater fish. Man acquired infection by injection of undercooked infected fish. Gnathostoma is Spinigarum pathogenesis. Young worm migrate through liver causing destruction of liver tissue having characteristic yellow marking on the surface and the tract are filled with necrotic material. Adult worm penetrate into the stomach mucosa producing cavity filled with sanguinopurulent fluid and each contain 9 worms. Later on, the cavity develop into thick cyst or tumor connect to lumen of stomach by small canal which may cause peritonitis. Gnathostoma spinocerebellar diagnosis, examination of faces of egg, but egg are not always present in the faces. Treatment: benzimidazole compound. Gnathostomiasis in human being causes creeping eruption. Thank you.